We're joined from our Cape Town studios by the Director of Rape Crisis, Kathleen Dey. Thank you so much for coming into our studio this afternoon. Kathleen, you've been making a real concerted effort with the help of government funding to be able to make this, to treat it as a national crisis. Why aren't we succeeding?
I think, thank you, Joanne, for inviting us on the program, but I think there is a lack of resources being allocated to this issue, both on the side of services that are designed to empower victims to see their cases through the criminal justice system, and on the side of prevention programs that will look at the state of the youth in our country and design programs that really work to address these kinds of problems. There are organizations throughout South Africa that are closing down that deliver these kinds of services. And even within the criminal justice system, there isn't enough resource allocation to process these cases quickly and efficiently.
Why doesn't the will exist to do this? We know it's a national crisis. Why aren't government ministers buckling down and saying, this is what we're going to put our money into for the next few years?
Well, at the moment, there are no political leaders that champion this cause. I think that's a vital ingredient to driving resources, to have a political champion that really keeps this high on the political agenda. That kind of championship is often driven by public opinion. So the outrage that our country has expressed over the last few days is very effective in doing that. But also that leadership needs to carry through into long-lasting solutions such as legislation. Ultimately, resources are driven by legislation, and this government needs to enact the kind of legislation that empowers victims.
Don't you think our legislation is tight enough at the moment? Isn't it the implementation of this legislation that's a problem?
It's a combination of the two. The Sexual Offences Act is not entirely a brilliant piece of legislation without going into too much detail, but certainly the implementation of it is a problem. And again, there one needs resources, one needs personnel to be trained, one needs effective tracking systems of cases from the police to the health facility to the court, which at the moment all have their own information management systems. So there are a variety of different problems there. There isn't enough collaboration between government departments to ensure that services coordinate with one another smoothly. And it's very difficult to hold officials accountable for things that go wrong. It's very difficult to complain and see somebody actually held accountable for either poor performance or for non-delivery. So implementation is certainly a problem. But we are also looking at something that we call victim empowerment legislation that falls more within the ambit of the Department of Social Development. I mean, this is a department that gets much less of the budget annually, and which almost regards itself as a stepchild within government. Much more resources need to be allocated to that department, because it's that department that's responsible for the psychosocial care and the services that empower the victim of rape and the family of that victim as they go through this incredibly difficult journey of reporting, of forensic examination, medical treatment, and of course a court appearance. You can imagine how difficult that is and how much support is needed to have a strong testimony on the right day in court.
I was listening to a rape researcher earlier today, and she said a very interesting thing about the kind of programs that we're running, that government and civil society chooses to plow money into. I mean, do we have enough programs to educate our boys as they're coming through the school system, to actually give them a sense of what gender equality is about?
We don't have enough programs, that's absolutely clear. But what is difficult about those programs is measuring their success, is having a really scientific way of measuring the impact of those programs. Can we set clear enough indicators of our progress to know that those programs are really helping? And I think that's a worldwide problem. I think researchers from the World Health Organization, from the United Nations, from all around the world are really struggling, well, perhaps not struggling, perhaps this is an urge of creativity coming in here, to find innovative programs that one can measure the success of, because in the past a lot of money has been plowed into programs that might look good on the surface but don't really deliver a lasting impact.
Thanks very much for talking to us this afternoon. Director of Rape Crisis, Kathleen Dey.
My pleasure.